welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe to the show at kevinmd.com/follow. Today we welcome back on the show Farhan Imran. He's a hematology oncology physician and he wrote the Kevin MD article, "To My Patient Who Is Going to Lose Her Hair from Chemotherapy." Farhan, welcome back to the show.
Thank you, Kevin. Always good to be back on your show.
So we'll get into your article in a little bit, but just tell me, since we last spoke, how's everything going with your hematology oncology practice?
I think things are going well. During COVID, we went to do a lot of televisits, but now it's back in full form. It is very exciting to see the pandemic coming to really the tail end, and slowly the hospital is removing the masking policy in some outside areas. Masking policy is gone in the community. So those are all very good. It's a good feeling to see that.
Sure. And I know that we've talked several times during the pandemic over the last few years. Now, how have you changed as a physician during?
Well, that's a very interesting question. I think as physicians, I personally can say that I've become more resilient in the sense that I have more confidence in my profession because no living person had seen this pandemic, because the last real pandemic, the Spanish flu, was in the 1918, which is exactly 100 years ago. So anybody who would have been alive would have to have at least 10 to 20 years of age to remember that, and nobody living person knew that. So the pandemic was actually very exciting to me professionally because we deal with epidemics or local diseases, but a disease of this magnitude was the first time we saw it. And then when it hit, it was a big element of nervousness as to how are we going to deal with all of that. And I know I don't want to minimize the number of lives that were lost and the toll it took on the doctors and nurses and all other healthcare professionals. But now we are coming out of it, and it almost looks like the springtime of the pandemic. So I would say more of a resolve, more resilience, and more trust in the science and the profession. That is how I would sum it up as I personally came out of this pandemic.
Now let's get on to your Kevin MD article. You always share such interesting and wonderful case studies and stories, and this one is no exception. It's titled, "To My Patient Who Is Going to Lose Her Hair from Chemotherapy." Now, for those of you who get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Sure. So the reason I wrote this, Kevin, is because I have a general hem-onc practice, but I focus more on breast cancer, and as part of the treatment that I give is chemotherapy. And chemotherapy is associated with cancer for the last several decades. And I had a number of patients, mostly women, who were just so terrified of going through chemotherapy. And then when I dug deeper into it, I found out that they were not as much worried about the things that I was worried about, such as neutropenic sepsis or neuropathy, kidney or renal dysfunction, but they were so extremely scared of losing their hair that I wanted to kind of reach out into their mind and try to speak with them as to how they're feeling about it, how I understand it, and what I want to say to them. So, of course, a lot of thoughts came to my mind, and not everything can be discussed with each patient and each visit. So I thought I'll put it together as a piece and where I sent it to you. And really, the way I start with is to tell the patient that, you should be okay. And it's almost like, I wouldn't say an apology, but in a way, I'm telling the patient that, bear with me. This is the best that we have right now. Because if you look at the history of medicine, I say in the article that if you Google, anybody who's watching this podcast, I encourage them to Google forced standing. And when you Google forced standing, a picture, if you click on a picture, an image of a girl in her teenage years comes up in a room where she is forced to stand with some ropes tied to her arms and to her neck. And she's being forced to stand, and initially you don't realize what it is, but when you read the caption, now I don't know how verified information that is, but I wouldn't be surprised if it's true, because the history of medicine is full of examples of treatments like that. But this was just about 100 or 200 years ago when depression was treated like that. And
Mm.
probably the thought was that if somebody's laying in bed all the time and if you stand them up, then maybe their depression may be cured. And that is how depression was treated. And probably at that time, the major medical societies would be endorsing that kind of a treatment. But in today's day and age, whoever I have shown that picture to, you almost gasp in horror and you say,
Mm.
this looks like a scene out of a horror movie scene. So that makes you think that, okay, if this was just a couple of 100 years ago, what are some of the things that we are doing in medicine today, which somebody from 300 years later will look at and then they will gasp in the same way, thinking, oh my God, that's what we were doing, but today we're doing it, that is the best out there. So the same way, if you take, let's say, a woman from today who's going through cancer treatments, and she loses her hair and you see all those patchy bald spots, and a few 100 years later when chemotherapy is a thing of the past, people will look at today pictures of today's women and they will be just terrified by looking at those pictures and they will say, oh my God, this is what you guys were doing
Mm.
at that time. So that's where I start with, but I also want to caution you that anybody who I have given this analogy to, the next conclusion that they derive from it is that chemotherapy is bad, it's poison, it's sinister, it should not be done. But in today's day and age, it is still the mainstay of treatment of many cancers. And science is progressing. If you look at science, we get this question a lot where people say, oh, why is there still no cure for cancer? You just have to zoom out a little bit. If you compare the cancer care or cardiac care or any other care from 3 years ago, you may not see much of a difference. But if you look at care difference 30 years ago or
Mm-hmm.
50 years ago, which is not a big time frame in the history of the world or history of medicine, you will see that we've made tremendous leaps and bounds in how treatment is done. So for people who do not practice oncology or non-medical, chemotherapy is something, these are drugs that go through the IV and they kill the cancer cells, but they also kill normal cells in the body. And that's how you can have low blood counts, you can lose your hair. But now there are new treatments that are coming, such as immune therapy and oral molecularly targeted therapies. They are more effective than chemotherapy, but they don't have some of those severe side effects, including the hair loss.
Mm-hmm.
So they have not yet taken the place of chemo, but they are now getting there. And as I've said here before as well, that as an oncologist, my dream is, I hope that within my career, within my lifetime, before I retire, I will see a chemotherapy-free world of medical
Mm-hmm.
oncology. So that is really kind of the preamble of what I wrote about.
So take us into the exam rooms, into one of those conversations whenever a patient comes to you and they're concerned about losing their hair from chemotherapy. Take us into the exam room. Tell us what that conversation is like.
Sure. So basically, some women are more concerned, and I say women because men are also concerned, but typically men are not as much concerned about it as women are. And some women have literally even refused chemotherapy just because of the hair loss issue. So the first thing that I do, I mean, of course, you want to reassure them, but the first thing I do is I ask them, how long have you had the same hairdo? Which actually I can put that question to anyone. So I can say,
Mm-hmm.
Kevin, how long have you had the same hairdo? Or anybody who's watching this podcast, I ask them how long you have had the same hairdo. 9 out of 10 people will say that they have had the same hairdo for as long as they can remember. 5 years, 10 years, or forever. But when you go through chemotherapy and when you lose the hair and when the hair comes back, the hair comes back as a different texture, as a different color, as a different style, and it goes through different amounts of length of hair. And those people who handle this issue best, they style their hair at every different stage in such a nice way that they carry themselves really well.
Mm-hmm.
So it is more of, it's not as much our fear of losing hair, but it is a fear of how we will look in the eyes of others.
Mm-hmm.
And an example is like if one morning, if I by mistake shave right side of my mustache, how will I walk into work? I'd be extremely deeply embarrassed. So that's the fear of embarrassment is really what is driving them. So then I tell the patients that, those people who love you, they will not judge you for whatever look you have. They will always love you like that. And really, there will be very few people who will look at you and you will look odd to them. And everybody will be very understanding of it. So all this is inside your own head. This is you looking at how you are looking at yourself. So I try to tell them that, think about it and try to come out of that fear. It's easy for me to say, but at least I'm verbalizing my support for them in such a time. And then there are so many ways, like women will wear wigs and bandanas, and some women will carry the bald look, and they will actually look really very good. And the funny thing is that sometimes the new look looks better than their older look, than what their older look was. So that is one of the things that I talk about. Another thing that I touch upon is look at movie stars. So let's say look at Tom Hanks or look at Brad Pitt or look at Meryl Streep. In every movie, they have a different look. So if you look at Tom Hanks in Forrest Gump, or if you look at him in, I don't know, Castaway, they come in with a different look, so much so that we get used to their different looks. So if somebody says, what is Tom Hanks' main look? There may be a look that comes to your mind, but they will look good in each one of their looks. But it will not look odd to us. It will look good to us. So some people in life are the ones who are always experimenting with their hair, with their look, with their clothes, and they are wearing different things. Most of us get into this uniform. Like if I wear a
Yeah.
jacket to work, then every day I'm wearing a jacket to work. But some people who mix it up, they don't have that fear as much as the people who have had the same look all along. So just to try to give that example, just to try to reach out into the patient's mind and to tell them that, just think about it that way, maybe that will help them. And then
I'm going.
one other point that I wanted to make was that some women may appreciate this example, some may not, but I kind of, when a woman comes to me with breast cancer and she has to go through 3, 4, 5 months of chemotherapy and go through all these changes and how their hair look, how their body looks, and then it takes another 5 or 6 months for them to come back to their prior self. Sometimes I give them the example of pregnancy. So for a woman, becoming pregnant is it's one of the most beautiful things, but it's also one of the most difficult things. Like, for example, Madonna, when she became pregnant, so somebody asked her after the baby was born, a journalist asked her, how was your pregnancy? And she said, I think this is the biggest joke that God played on a woman. Anyways, so jokes aside, when you get pregnant, you can gain weight. There are unflattering symptoms, nausea, bloating. But at the end of the day, when the baby is born, it's all for a good cause. When you look at that baby, you're so much in love with that baby that all the difficulties of pregnancies are considered worth it. And then it takes some effort to bring yourself back to the same weight and the same fitness, but eventually you get there. So the same thing with chemotherapy. The goal is for cure. The goal is for the cure of that cancer, so that cancer doesn't take the patient's life. And fine, the body goes through these changes, but eventually, if you see women a couple of years after chemotherapy, you can't even tell that they went through any treatment like that. So some women, that example may settle in well with them, but that's just my attempt to reassure them that they'll be okay.
So when you have these conversations with patients and you share that approach, what are the spectrum of responses that you get?
I feel that a lot of women do hear that and they do understand, but still the anxieties remain. No matter how many words you use, they remain very, very anxious. And basically, I think what helps a lot is, rather than have one conversation, ongoing conversations approaching the same topic, also some of the other family members that are in the room, to have them talk to the patient along the same lines when they are at home and address these issues rather than not confront them and brush them under the carpet. So repeated discussions with the patients, our nurses are excellent, our oncology nurses, they have repeated discussions with them. but the anxieties remain. But the thing is that after chemotherapy starts, in about 2 to 3 weeks, the hair starts losing. And once the hair starts losing, and once they start getting their new look by wearing a wig or a bandana, then it kind of settles down. Then they say, okay, well, probably it was not as bad as it was before.
Hmm.
So it's the period between the diagnosis and the start of chemotherapy which is the most crucial.
And give us a sense of when the hair does grow back after chemotherapy completes.
So basically, what I tell my patients is that as long as it takes for the chemotherapy regimen to complete, like some chemotherapy regimens may go on for 3 months versus 6 months. So some women may think that the hair will come back right away in a couple of weeks after the chemotherapy is finished. No, it will be a very slow process and it may take as much time. So for example, it may, if it's a 6 month chemo process, it may take another 6 months for the hair to go to a point where it
Hmm.
looks like maybe they have not lost their hair. So it does take several months, but it does happen. It is very, very rare that a woman may have long-term hair loss, but that is very rare. Most of the times the hair grows back. There are some strategies like the cold skull cap therapy, which is not done universally. Some centers do it and some patients choose to do it, but that in itself can be a cumbersome and
Hmm.
an expensive process. And it's not 100% that if you do it, you will definitely not lose any hair. It makes a small difference, but what makes the most of a difference is how the woman carries herself through each stage of hair loss and hair regrowth. That's what matters the most.
We're talking to Farhan Imran. He's a regular contributor to Kevin MD, regular guest on the podcast. His latest article is To My Patient Who Is Going to Lose Her Hair from Chemotherapy. Farhan, what are some of your take home messages that you want to leave with the Kevin MD audience?
My take home message on this one, Kevin, would be that anybody who has been diagnosed with cancer and now they're going to go through any treatment, chemotherapy or radiation, they need a lot of support. And anybody who is in their life should reach out to them and give support. I cannot emphasize the importance of pep talks in oncology or in end of life or in any kind of care. So let's suppose I work at my workplace. I know someone relatively peripherally. I don't know them as well, and I find out that they're diagnosed with cancer or any other major negative event in life. So our common reaction usually is that we'll give them their space, we'll just say hi, and we'll just say, okay, I'm sorry. And then after that, we just try to stay away. But my message to people is please reach out. Please reach out. There's absolutely nobody who is going to mind. You can carefully ask them, hey, can I reach out? And by reach out, I mean that, if somebody is otherwise, let's say somebody is in housekeeping and all of a sudden they've lost their job because they're dealing with cancer or any other thing. Now they're sitting at home and all day they're doing nothing. Their family members, their friends, they are also at work,
Hmm.
and if you think that they're going to be there, they're okay. I mean, we should just reach out, take out time in the evening, on the weekend, just a phone call, go in and just sit there and talk to them. That is the main biggest treatment of these conditions. Like I've said before, that the science of medicine has progressed a lot, which is amazing, but the art of medicine is being lost in the EMRs and in the telehealth visits and all that. So this is really what the patient needs. The patient needs people, and
Hmm.
those people are nobody else. Those are us. So that's the message that I would give to anyone. Just look around you and reach out to anybody who's going through a hard time.
Farhan, thank you so much for coming back on the show and sharing your time and insight.
Thank you, Kevin, and thanks for giving a voice to all the healthcare providers of America and across the world.